Welcome back, everyone. We're here for the final video in our pregnancy series, joined again by Dr. Taylor, the chiropractor at Willowbridge, and myself, Dr. Renee, the physical therapist at Shift Physical Therapy. So today we're going to talk about the postpartum period, and Dr. Taylor is going to tell us all about chiropractic care for the newborn, and I'll be talking about the postpartum period for new moms and some of the issues that they might be experiencing. So I'll let Dr. Taylor take it from here.
Thanks. Yeah, so I get a lot of questions about why would a newborn or a child or baby need to be seen by a chiropractor? And that's a really great question. And if you remember from our previous videos, I talked a little bit about how chiropractic isn't necessarily about neck and back pain, but just more about how you're functioning. And we're going to look at the same way that we're taking care of baby too. So we think about how delicate a baby is. And now imagine the stress of the birth process upon a tiny baby spine. And the effect of birth on the spine is the most overlooked health problem in our society for two reasons, because there's no obvious symptoms and no visible trauma. So a child's health and health of their spine are intimately related. It's well documented that even so, the most normal, routine, easy birth processes can place a lot of stress on that spine. And it's the primary cause of actually our first subluxation. And subluxation, that I should explain a little bit more too, subluxation is when that bone misaligns within the spine. And so as a child grows, subluxation can interfere with the rest of the development and proper body function, and it's just going to limit our ability to kind of express complete health. So what we're looking for as chiropractors, or why you may want to bring your baby in, is maybe your baby is dealing with some difficulty breastfeeding. Maybe he or she prefers one side or the other, maybe some torticollis or colic. We see a lot of ear infections. And so these are just some symptoms that you may notice with baby that may have a subluxation. And also, baby may not have any symptoms, and that's great. But that doesn't mean that they shouldn't be checked by a chiropractor, just to make sure that their nervous system is free and clear and there isn't a subluxation going on. And so another question I get is, what does it look like to adjust a baby? And it's actually very gentle. It's a lot different from what it looks like for us to get adjusted. So baby is adjusted with just a sustained contact. It's just a small hold on the bone. And it's no more pressure than you would use to check the ripeness of a tomato. So it's very gentle. Kids are very innately in tune and just know what their body needs. So giving an adjustment to them is a really cool experience, and they just melt when it happens. So if you are looking to come in to see a chiropractor, would love to see you and your babies. I can be reached at 763-645-1192, and I'm at Willowbridge and Willowbridge Chiropractic.
Well, thanks, Dr. Taylor, for giving us a little bit of information about chiropractic care for the newborn. Let's turn our attention to the postpartum mom for this next part. So now that your little baby has arrived, there can be a lot of changes to mom's body that need some attention. So I'll talk about 3 common issues that arise postpartum, including pelvic pain, abdominal changes, and urinary leakage. Just because these are common issues does not mean that they are normal changes. Your body might feel very different than it did before you became pregnant, and pelvic floor therapy can help you build back confidence and control of your body. So the first thing that we'll talk about today is pelvic pain. So maybe you're experiencing some pelvic pain after the marathon or sprint of delivery. And maybe you're having pain in the pelvic area while you're walking, using the bathroom, during sex, or even just at rest. These are all signs and symptoms that it's time to give me a call at Shift Physical Therapy to schedule your pelvic floor physical therapy evaluation. Secondly, perhaps you're noticing some changes in your abdomen that didn't seem to be the way that they were before delivery. So for some, it may be that you've noticed a gap along the middle of your abs that wasn't there before, or maybe you had a C-section and some of the abdominal tissue doesn't seem to look quite the same. In pelvic floor therapy, I can assess what all of those changes are coming from, and then we can work together to find the right exercises to help you gain back confidence about your abs, even with all the changes that have happened. Contrary to popular belief, you can have strong abs after having a baby, but it's important to work safely on regaining that strength. Thirdly, let's talk about urinary leakage or incontinence. This is probably one of the most common issues that women experience after childbirth, but it doesn't have to be your new norm. Research shows that women who are told to just perform Kegel exercises without actually being taught how to properly identify their pelvic floor muscles can actually be performing those exercises incorrectly and causing their urinary leakage symptoms to get worse. So come see Jackie and I. We can work with you on correctly identifying your pelvic floor muscles, and we can help build back strength and confidence to be able to return to activities or even just sneezing and laughing without having urinary leakage. So often these issues aren't discussed with your provider at your postpartum checkup. However, we want to really open the dialogue with some of these commonly experienced issues and make for sure that it's something that you can get help for. So talk to your medical provider or call us directly at Shift Physical Therapy at 763-645-1113, and we can get you scheduled for your women's health specialty care. We do not need a referral from a medical doctor to see you at Shift Physical Therapy to get started with your care. So give us a call if you're experiencing any of these issues that are commonly occurring after having a baby. So thanks to everyone for joining us for this pregnancy series. We hope it was helpful and lots of good information for you. And reach out to either Dr. Taylor or myself with any questions or concerns that you might have.
Thanks, everyone.